So thank you, everyone, for coming. You're in the Workforce Development Breakout Group, so if you're not meaning to be in the Workforce Development Breakout Group, now's your chance to escape. I won't judge. Bye, Rob. My name's Chris Merritt. I'm the subcommittee chair for this, for the Workforce Group. And I want to thank all of you for coming and also thank our moderators who will introduce themselves in a bit in your tables. So I'm going to start. We have a couple of crowdsourcing resources that we're going to use during this session. So you're going to be able to vote kind of in a series of polls at the website that's on the screen. It's called slido.com, S-L-I-D-O.com. So pull out your mobile device or your tablet or your laptop, and you can just enter that into your browser. And then in the spot where it says enter event code, the event code is the word workforce. And this is what it'll look like on your phone if you're doing it that way. So you should see one poll that's already live, and at any point you should feel free to vote in that poll. And in addition, we have the obligatory hashtags for the SAEM conference overall, the consensus conference, and this workforce, in case you are prone to tweet. So in 2006, the Institute of Medicine issued a report regarding the state of pediatric emergency care in the United States, and they reported continued concerns about the ability of the emergency care workforce to care properly for pediatric patients. Among their concerns included uneven training and continuing education of emergency providers in pediatric competencies, inadequate development and distribution of clinical practice guidelines and care standards for emergency care of children, and the importance of local pediatric emergency readiness and coordination. Now, some of us might bristle at the suggestion that our workforce is ill-prepared to care for children. And while the decade since the publication of this report has undoubtedly yielded improvements, and thanks in large part to many of the people in this room, the folks who take care of children in emergency settings continue to face increasing demand with uneven capacity. And many of us here today, of course, are subspecialists in pediatric emergency medicine, and we're boarded by either the American Board of Pediatrics or the American Board of Emergency Medicine. And often when we talk about the emergency care workforce in the context of pediatric care, this is who we're talking about, or at least this is who we think of. And it'll probably not be a surprise to this audience that the majority of PEM subspecialists are boarded through the American Board of Pediatrics. As of January of this year, there were just over 2,100 actively certified PEM subspecialists through PDM in the American Board of Pediatrics. And in contrast to that, of the 35,000 plus diplomates of the American Board of Emergency Medicine, there are, as of January, 256 certified in PDM. And while over the past 15 years, the number of fellowship spots for PDM programs has continued to steadily increase, we're certainly far from being numerous or evenly distributed enough to provide care for most children seen in EDs. And if you look at the distribution of PEM subspecialists in the US, it should also be no surprise that we're not exactly spread out evenly. In my state of Rhode Island and our neighbors in Massachusetts and New York, there are between 6 and 8 PEM subspecialists for every 100,000 children. These data are from the ABP, so this is not including the emergency medicine boarded folks. But if you look to the west, you can see that there are 4 states that ended last year with no ABP boarded PEM subspecialists at all. So the range then goes from 0 in those states to just less than 1 PEM specialist per 100,000 children here in Indiana, to as many as 16 per 100,000 children in the District of Columbia. So evenly distributed we are not. And so that leads us to the obvious point, and one which we probably all know, which is that most children seen in U.S. emergency departments are seen in general EDs, cared for skillfully by a broad coalition of emergency pre-hospital providers, nurses, technicians, pharmacists, and physicians of a variety of different specialties. And so our charge then today is to sort out how to identify what progress has been made stemming from that IOM report of just over a decade ago, and how to assess what remains to be done to assure the ability of the emergency care workforce to care properly for pediatric patients. So we hope to arrive at a research agenda which will identify and inform the needs of this workforce to this end. And so our goals today are to identify the highest priority areas of research into workforce needs in pediatric emergency care, to engage a group of stakeholders, that's you people, in a discussion of means and targets for workforce research in pediatric emergency care, and to identify opportunities to translate this knowledge and evidence into the care environments where we're actually caring for children. Of course. Right, right. Now, I was hoping to sort of, that's part of what this sort of consensus process is to sort of help us divine some sense of consensus. And so I don't want to be too prescriptive in terms of like what specifically we want to talk about. And so if, I'm going to sort of punt a little bit on that question. So we'll be working towards consensus through kind of a series of iterations, and I'm going to just briefly walk you through it before we jump in. So the process started with the planning committee, as you've heard throughout the day, who identified a series of domains, if you will, pertinent to the future of pediatric emergency research. And workforce development is one of the 5 domains that we've identified. Subsequently, a working group of us identified a series of themes within the workforce development domain around which we hope we can sort of build this research agenda. So we identified themes such as the epidemiology of what we're calling the epidemiology of the pediatric workforce. That is, who's taking care of kids, where, when. We want to talk about burnout and strains on the pediatric workforce. Readiness is something that I'm sure they're talking about next door in a non-children's hospital session, but I think that it's important to think about that in terms of workforce development as well. What are the career pathways into the pediatric specific workforce? And what are the roles and opportunities for advanced practice providers in pediatric emergency care? Yeah. Yeah.
Making sure we know that what you're talking about here would seem important, even though we don't really know what it's going to be like. Our sense is going to be a lot more distance held. We're not going to put providers at 4,200 hospitals that are PDM fellowship trained, but regardless of which pathway they take.
Right, right.
So it's going to need to be something that the expertise is useful, what the skill set is.
Yeah, yeah, absolutely. And what are the... Yeah, and you're right. I don't think we necessarily know what we will need, and I also want to be sure that we're thinking about the pediatric care workforce broadly in the sense of like what are the needs of at the interface between the patients and the providers, who are not necessarily PEDS specialists. So just to, again, briefly sort of walk you through the steps. So we sent out a pre-conference survey to try to assess whether we were on the right path. And we got some good feedback. I think it helped us kind of narrow our agenda today a little bit. If you haven't already, I would encourage you to click on that poll and identify some areas that you think are of the most import and utility to talk about today. In just a few minutes, I'm going to shut up, and I'm going to have you guys start doing the talking. And I think that these are the exact kinds of discussions that I'm hopeful that we'll have over the course of the next 45 minutes or so. And then at the end of this, we are going to come back together as a larger group to try to do our best to prioritize sort of a research agenda. So again, that is the poll. At your tables, so over the next 45 minutes or so, I'm going to sort of give you two tasks, and you can take these and run with them a little bit. I want each table to discuss and identify sort of two of those broader themes that are of the highest priority to the folks in your group. And from each of those, I'd like your tables to identify probably two specific research questions that you think are of the highest priority within those themes.